Good morning, everyone, and thank you for joining us this morning. Welcome to University of New England's Graduate Programs of Public Health webinar. My name is Jennifer Seedy. I am the Assistant Director of Public Health Workforce Development. This is actually our second webinar that we have launched, our first being in grant writing. So if you are interested in that, feel free to let me know in the chat box. This is part of our focus on providing professional development events that are relevant and easily accessible by our public health workforce. So today we are focusing on fundamentals of financial management and budgeting for non-financial public health professionals. This is part one of a three-part series. So today is session one, and today we'll be focusing on the importance of financial management, organizational goals, and understanding financial management terminology. Session two will be launched on October 3rd. Types of budgets and budget processes will be discussed. And session three, which will round out our series, will be launched on October 17th, performance management, financial controls, budget variance analysis, and corrective action plans. Just so that you're aware, there are two handouts available to you in your toolbar, one being the PowerPoint presentation and another one being a reference sheet that includes key concepts and references for you. Also, we will be launching a poll, so remember to remain engaged and have fun. And it is with great pleasure that I introduce the developer and presenter of this series, Dr. Rebecca Arsenal, to you. Dr. Arsenal is an adjunct faculty member here at our program. She has over 30 years of experience in hospital administration and has served as CEO at several hospitals throughout the U.S. Through her career, she remains committed to public health and community wellness initiatives. She has a doctoral degree in health administration, while her bachelor and master degrees are in nursing. It has been wonderful working with her as she developed the series, and my hope is that this webinar aligns with your professional goals and that you feel better equipped in the areas of financial management and budgeting. So without further ado, I present you Dr. Arsenal. Thank you for being here.
Jennifer, thank you, and thank you for the kind introduction. Again, my name is Becky Arsenault, and I've had the pleasure and privilege of serving as a member of the adjunct faculty for UNE over the past almost 2 years, having retired from my health administration position. And this is a second career for me, and so I hope that I can bring some practical experience from my few years in healthcare to you in your professional practice in the field of public health. So let's talk about the purpose of this particular webinar and today's session. I have designed this three-part series for public health professionals who have limited knowledge about financial management and budgeting, but who really want to learn about key financial management and budgeting principles and concepts and their applicability in the delivery of public health services. So the audience for this particular webinar is really intended for public health professionals, nurses, physicians, and others who have limited financial management and budgeting knowledge and experience, but who want to learn and who may well aspire to seek a leadership role in health or elsewhere in healthcare. I am speculating that you are participating today because you are a non-financial public health professional. Although I did note in the registration materials that we do have an individual registered who is an accountant. So that's a little intimidating for me, because although I'll be using some accounting terms, I'm going to try to put it in language that the majority of the audience will understand. I know as I've worked with chief financial officers and accountants and other financial professionals through my career, they would often laugh at how I would describe a particular financial scenario. And so for the accountant in our group here this morning, bear with me. I'm going to try to make this relevant for individuals who don't have that background in expertise in accounting and financial management. I would also speculate, as a member of this audience, that you may be somewhat intimidated by the concept of financial management and budgeting. Well, I can relate to that. As a young manager in community health, I was overwhelmed by suddenly being responsible for budgets and financial management and payroll and other aspects of leadership in the agency where I worked. And I was frustrated and extraordinarily intimidated because I did not understand the world of finance. I didn't understand the terminology in the world of finance. And for me, I recall the feeling that the finance people in that particular agency seemed to be in charge of patient care. And that was the ultimate frustration for me. Now, hindsight-wise, that really wasn't the case. But as a young novice manager, I felt the individuals who held the purse strings also held the power over patient care, and that wasn't okay with me. So I took action. I quietly and without letting anybody know, took both an accounting and a managerial accounting course. Starting with the accounting course, again, talk about feeling overwhelmed. But the good news, I took the course, again, in a master's program. I took it on a pass-fail basis. I thought, I don't think I can fail this course, so the worst I can do is just pass it by the skin of my teeth. And then proceeded to take managerial accounting, which is really where I learned how to apply financial principles to the delivery of patient care. After that, I proceeded to take a number of continuing education courses, and one of those was provided by a gentleman whose name is Stephen Finkler. Stephen is now a professor emeritus at New York University. He has written numerous books, and one of those books is on your list of references. So I would encourage you, if you have an opportunity, to read some of Dr. Finkler's work. Our learning objectives today, I think, are pretty straightforward. I think it's important for you to recognize the importance of financial management in the delivery of public health services as a public health professionals, and identify where does the money come from when it comes to the delivery of public health services, and begin to understand some of the basic terminology when it comes to financial terminology in healthcare. And certainly in weeks 2 and 3, session 2 and 3, we will be talking a lot more about terminology. So let's pause for a minute and look who is with us on the line participating in this webinar. We have a total of 29 participants, 12 individuals from Maine, 7 from New York, 2 from Oregon, and 1 each from New Jersey, Michigan, California, Nevada, Connecticut, Louisiana, and Illinois. That was a mouthful. And so I know all of us here at UNE are very pleased that we have wide participation across the country. That is both a positive, and it also brings with it a negative, and we'll talk a little bit more about that. Since the delivery of public health across our nation is varied, to say the least. And so that impacts where does the money come from to deliver public health services? And that's going to look quite different in the state of California versus the state of Michigan versus the state of Maine. 10 of you have less than 1 year's experience in terms of financial management. 10 of you have 1 to 3 years. 4+ years, there are 4 of you, and 3 of you didn't want to respond to that question, I guess. I have listed here the experience that a number of you have in financial management, and most of that is in managing grants, which is very exciting. And we'll talk about grants and what some of the implications are for financial management and some of the challenges in managing grants along the way. And then I've listed titles, and a number of you have the same title, so I didn't list it twice. So this gives you a little bit of a sense of who is in the audience with you today. Now we're going to put you to work for just a couple of minutes, and Jennifer is going to walk you through what you have to do to complete the poll. I understand it's pretty easy, but let's talk about the question. The question is, what is your experience and comfort level with financial management and budgeting? I believe the poll is now open. You have the choice of excellent, very good, good, fair, or I run the other way when I see the chief financial officer coming, which would be none.
Okay, so almost all of you have responded, so we'll give you a couple of more seconds.
And we really appreciate you doing this. It gives me a sense of individuals' comfort level when it comes to this topic. So,
okay. So now we'll share the results with you all.
Okay, great. So the majority of you have a fair comfort level with financial management and budgeting, but we also have 38% of you who feel pretty good or very good, excellent. We don't have anybody excellent. We have very good and good comfort level with financial management and budgeting. And 15% of you are in the early stages of learning about financial management and budgeting. So good, that gives me a really good sense of who we have in the audience. Thank you. So we're going to move on and start really with the basics. When we talk about financial management, what do we mean? It is a mix of finance, accounting, and management concepts used to assess, predict, and minimize economic loss to achieve stated goals in an organization. Now, I don't mean to read to you, but I think these definitions are really important. And public health finance is actually a field of study that examines the acquisition, utilization, and management of resources in the delivery of public health services, and the impact that these resources have on population health and the public health system. So we will use these two definitions as really the framework for this entire webinar. So now I'm going to share some personal bias and philosophy with you. And it is a conversation I have had with colleagues throughout my career. And my bias is that planning and financial management and budgeting are the most of all of the managerial skills that are out there. Some of you may disagree with that because there are other management skills such as human resource management, change management, quality improvement initiative, coaching and mentoring, and so forth. But I believe without planning and without financial management and a successful and viable organization from a financial perspective, all of those other skills and attributes that managers have are really blocked, if you will. If an organization is in crisis from a financial point of view, then change management is going to be extremely difficult, if not impossible. So again, I share my bias of planning and financial management and budgeting being at the top of the list for all of us when it comes to leadership and management skills. Financial management is very time consuming. It is not something that you in a leadership role, if you are in a leadership role, can do in your spare time. It must take a considerable amount of your leadership time. And we'll talk more about that when we get into budgeting and budget management in a couple of weeks. And lastly, and probably most importantly, organizational financial management is not the sole responsibility of the finance folks. I know that in some organizations it may feel that way, but it is truly a multidisciplinary team effort with members of the public health team and public health professionals and leaders actually being at the forefront of how finances are planned for and managed in an organization. So when I talk about planning being one of the most important leadership skills, what do I mean by that? Well, first of all organizations have a mission and a vision. The mission is the reason why your organization or program exists. And the vision is really a snapshot of the ideal future that your organization would like to see in the community. What are you ultimately working toward? And so I believe a leader must embrace both the mission and the vision of an organization and understand the proverbial phrase, if an organization has no margin, then there is no mission. You cannot exist, your organization cannot exist successfully unless you have a financial margin that allows you to develop programs and implement programs. And by planning, I mean, how do we use the mission and the vision of your organization to develop a strategic plan that leads to the operational goals and objectives to carry out the work of your organization. And in this process, in the strategic planning process, financial strategic planning is as equally important as is operational and program planning. You've all seen strategic planning models, and I'm sure regardless of your role in your organization, you have been involved in strategic planning in some fashion. But I will tell you that there are strategic plans for public health organizations that make no mention or little mention of finances as a strategic objective. Strategic management, budgeting, and the attainment of resources for your programs. Here is one example. It happens to be from the Ottawa, Canada Division of Public Health, and I know it's really hard for you to see this particular slide, but let me tell you, there are broad goals and objectives that are surrounding the mission and vision of this organization. And then there are many objectives and tactics outlined. It's a great looking model, but if you really get down and look at the fine print, there is little in here about the financial side for this organization. Now, this is a municipality. It is a county, if you will, in Canada, and finances may be already defined, and they don't need to worry about finances. But it is still something that should be reflected as part of the strategic plan. So let's switch gears just a little bit. And as we begin talking in more detail about some financial management concepts, it's important to look at what are the public health systems in our country. And I use the word systems plural because there are many, and depending upon where you are in the United States, those systems can look very, very different. There are federal organizations, state agencies, local organizations and agencies, and all of these together drive the funding sources for public health. So there's no one system and there's no one source of funding, and I know that you all know that, given your roles and responsibilities. So the public health system in the United States is comprised of federal agencies, state, county, city, town, municipality, health departments and health boards, hospitals and other health or primary care providers, the tribal health departments for the Native American population, numerous volunteer organizations such as the Red Cross, and more we are seeing insurance companies enter the world of wellness and public health for subscribers. And of course, there are a myriad of federal agencies that make funds available. And I'm not going to read all of these to you. I think they are probably quite familiar. And you probably have grants from these various agencies that help support the work that you do in your particular organization. So let's talk about the sources of funds for the delivery of public health services. And this is important because it is often the source of funds that drives how those funds are managed financially, and to the degree, including a lot of record keeping by your finance folks and by you, if you happen to be the program director responsible for certain grants. So there's local funding by municipalities, by counties. There is actually financing. Some of you may live in a geographic area where there is a county tax that then goes toward the support of public health services in the community. There are state funds, and the states also manage federal pass-through dollars. There are also grant funds that come directly from the federal government. And more, we are seeing public health organizations providing services that are reimbursed by Medicare or Medicaid or other insurance companies that can be billed for certain wellness services. Other private grants are a rich source of funds as well as fundraising. Before we move on, I do want to specifically mention, when it comes to fundraising, the accounting for fundraising funds is a topic unto itself, in that there are rules that apply to how funds are raised and then how they must be accounted for and expended based upon the fundraising activities. And I'll spend a little bit more time on that in session 3. So when we look at financial management, your roles primarily deal with the operating plans for your organization or for your particular program or department. And many of you, based on the information we collected at the time of registration, are responsible for maintaining an operating plan that is financially feasible and allows for services to be delivered in the community. You are managing one or more grants, and it is your responsibility to establish and maintain controls over those funds. And to do that, you have to figure out a way to be assure financial efficiency and effectiveness in the delivery of services through those grant funds, or funds that come from your local municipality or state funds or grant funds, as I mentioned. And one of the things I like to think about when I think about the management of an operational plan when it comes to financial planning is a model that is really a quality assurance model. The plan, do, check, act model that a number of you are familiar with is also applicable when you think about financial management and budgeting. As I reviewed the registrants for this webinar, I noticed that pretty equally, I think, you are working in and have responsibility for either governmental or non-governmental services. And so I wanted to touch upon the differences that you are apt to see in those two worlds. Now, by governmental, we mean you are involved in an organization or agency that is, you are directly employed by the federal government, the state government, or your local city or town. That is governmental. A non-governmental organization could be a not-for-profit organization. It could be a private organization, which actually could be for-profit. There are companies that provide wellness services, and we may not think about them as public health, but they are proprietary, wellness-focused organizations who happen to exist to make money. They are proprietary. They would fall into the non-governmental category. Colleges and universities, depending upon their sponsorships, could be either state or they could be a not-for-profit private entity. And colleges and universities are very involved in the delivery of public health services. Let's talk briefly about the differences in governmental and non-governmental financial systems. And there are many accounting differences that I wouldn't begin to pretend to understand, but that are important for accountants, chief financial officers in governmental and non-governmental agencies. But I want to mention just 3 areas where you, as a public health professional, may see some differences. Number 1, the financial statements, if you work for a governmental organization, may look differently and may have some different terminology. And we're going to look at some of that in just a moment. Number 2, the financial cycle for your organization may be different. Most governmental organizations have an October 1 start date for their annual budget. But if you work in a not-for-profit organization, you are more apt to have the beginning of your fiscal year in January or July. Now, why is that important? Well, it becomes very important if you are applying for federal grant funds, and those funds become available October 1, but your organization has a July 1 beginning of the fiscal year. You need to work very closely with your chief financial officer, which I'm sure many of you do, to make certain that the grant funds are in alignment with the financial cycle of your organization. And it is very challenging. For those of you who manage grants, I know this is something you have to deal with all the time. My money starts in October, but the organization's budget is already well on its way by October 1st. The other area I would mention is what I've called procurement, how you get your supplies and equipment in public health. It's going to be different, most likely, if you work for a governmental entity. And that is, you probably cannot just go to Walmart and pick up a box of photocopy paper. You probably have a purchasing process that you have to go through. If you need new computers, there is probably a bid process that you must go through as a governmental agency, and it can be frustrating along the way. I've been there. I've experienced a little bit of that frustration in my career. Even with a not-for-profit organization, there are purchasing practices and requirements that you have to go through. So I just bring up those two potential differences when it comes to working for a governmental versus non-governmental organization. And we'll leave all of the super detailed accounting differences for the experts in that particular area. So let's start talking about some of the key financial processes in all organizations. And I'm going to focus on really 3 of them that apply to an entire organization. We're going to talk about the statement of the financial position of the organization, the income statement, and a statement of cash flow. Now, those are terms that you may hear, and some of you might be quite familiar with them. But every organization, whether you are governmental or non-governmental, have these 3 reports, if you will, that are managed by your financial folks. And in some cases, you're very involved in the information in these 3 reports, and in other cases, you are probably not. So let's start with the statement of financial position, often referred to as the balance sheet. Now, the statement of financial position applies to governmental and non-governmental organizations. The terminology balance sheet, which if you take an accounting course, you will learn that term, is the terminology for a for-profit organization or company. The statement of financial position, or the balance sheet, is a summary of the organization's assets and liabilities. Excuse me. And that's what this very simple balance sheet demonstrates. I tried to pick out a really simple one. Most statements of financial position are much more complicated than what I am showing you here, but the concepts are the same. First of all, the organization's assets are what the organization owns. Do they own a building? Do they own desks and equipment? Automobiles? Do they own other property? All of those items are considered assets. Now, cash, or money in the bank, is also considered an asset. It is considered what is called a current asset. Those things that could be converted to money, to cash, within a year is generally the benchmark. So that could be money in the bank, it could be a certificate of deposit. But if there are other assets, such as building, equipment, computers, and so forth, those are called fixed assets. Those assets would take longer for an organization to sell, if you will, to convert it to an actual cash asset. So that is some terminology that you will hear in the world of finance. Assets and liabilities. Liabilities are items that an organization owes. An organization may owe payroll for the upcoming month. They may they may have to pay for supplies that were delivered last month. There are long-term liabilities and short-term liabilities. Short-term liabilities are current liabilities, they're called, are things like you have to pay the phone bill this month. That is a current liability. A long-term liability, you may have taken out a loan to pay for a building, a mortgage, to house your clinic. That is a long-term liability, and that is shown on the statement of financial position or the balance sheet. Before we move on to the statement of activities, let me give you a real practical example of what a balance sheet is. This is an example that actually comes from a website called The Balance, so I want to give that website credit. So let's pretend that you're going to go to a bank to get a loan to put in a new swimming pool. And the banker tells you he needs a list of assets and liabilities for you as an individual. So you go home and you begin going over your bank statements. You write down everything of value that you have, your savings account, if you have a certificate of deposit, you might have a mutual fund, you might have some stocks, you have a car, you have furniture, you own computers. All of those things are assets. And then you look at your liabilities. Do you have a car payment? Do you have a mortgage on your home? All of those things are liabilities. And so you deduct your liabilities from your assets. You have just created a personal balance sheet. So I think that's a really good example. So let's go on to the statement of activities, also known as the income statement in for-profit organizations. This is a financial statement that you may be more familiar with than the balance sheet. It outlines the revenue for the organization and where those revenues come from, and then the expenses, and then the bottom line. I'm sure you've heard that terminology. What does the bottom line look like? You take all of your revenues and you subtract your expenses, and is it a positive or a negative? We would like to believe that there is positive on the bottom line. So revenues are any monies coming into an organization. It can be grant funds, it can be funds from the community where you receive an annual allocation from your town or your city or your county. It can be revenue that comes from billing third-party payers. Remember I mentioned Medicare, Medicaid, and private insurance billing. It actually can include investment income. If you have money in the bank and you've earned some interest on that money as an organization. And then expenses are everything else. Payroll, supplies, paying the rent, paying for the telephone. And this particular, again, very simple example of an income statement is really for a specified time period, and that's what you'll see. Now, we don't know for this particular organization. This says for the 12 months ending December 31. So I'm going to assume that this organization had a fiscal year, which began in January and is ending December. And so this would give you a snapshot of an entire year for this organization. But it could also be for 2 months, an income statement for just 2 months. And in that particular case, you would probably have another column or two, which would show you how you're doing year to date, as well as how you are doing for the month or for a 2-month period of time. And the last financial document I want to talk about is the cash statement. Not many of us in the clinical world, whether in public health or healthcare provider, or even in a public health or healthcare leadership role, really understand the cash statement. But let me try to make it as simple as I can. Think about the fact that most of us, I guess I would say all of us, get paychecks, unless you happen to be independently wealthy and volunteer your time in your job, which I'm guessing is not the case. So you know when you're getting your paycheck. Well, let's say you get paid once a month and your paycheck is X amount of money. You get paid on the last day of the month, but throughout the month you have bills to pay. You have a mortgage, you have a car payment, you buy groceries, you pay for utilities, etc. But you don't get your paycheck till the end of the month, and your bills are due now. So that is a negative cash flow position. And so what any organization has to do from a financial point of view is to project out how the organization's cash position is going to be at any point in time. When payroll is due, the 15th of the month, is there going to be money in the organization's bank account to meet payroll? That is a cash consideration. Now again, this is a very simple example here. In a more complex cash financial statement, there would be many columns, and they would run out not only month by month, but actually might run out 1 to 2 to 3 years. So an organization can know by the end of this year, are we going to have enough cash to hold us? And the people in finance then determine, is there a need to have a line of credit for the organization? So when there is not enough cash in the bank, there's cash coming in, but we haven't received it yet, do we need to draw down a little on the line of credit? And so in your organizations, if you hear the finance professionals you work with talk about, we have a cash flow challenge right now, you'll understand what they're trying to do is to figure out, is there enough money in the bank right now to pay the bills? I hope that makes sense. I know in the past, I've sort of, when my finance people begin to talk about those sorts of things, I sort of shut down and go, well, there's nothing I can do about that. Well, there actually are things that we at the departmental level might be able to do. I can recall some examples of managers who worked with me who struggled because perhaps their grant allowed them to buy 15 computers to put into a school system to carry out certain public health and wellness programming. The grant money, part of the grant money has come in. Maybe the grant money comes in quarterly installments. It's time to buy those computers to start the programming in the school. But wait just a minute, the chief financial officer says, we have a cash problem. So we've got to figure out a way that we can pay for those 15 computers. And you as a program director says, but the grant will cover it. Well, we don't have all the cash from the grant source yet. So we've got to figure out our cash flow. That's a practical example for someone who's working in the public health field. So let's talk about some other reports that I know many of you see routinely, and we're going to talk more about these on October 3rd. The financial reports that you're probably most familiar with are departmental or program reports. You get your monthly financials for your department or your program. And those reports, and we'll look at a few examples the next time we come together, outline your expenses and your revenue for your particular program. Usually included in those monthly reports are statistical reports. What activity did you have in your department last month? Let's say that you have a clinic that is part of your program. How many clinic visits were done? And then lastly, your revenue and expense reports. Again, usually provided to department managers on a monthly basis, along with payroll reports that tell you really important information about the worked hours in your department and which hours were worked by your public health outreach workers, by you, by your department secretary, and so forth. And we will spend some time going over that again on October 3rd. So let's spend our remaining 15 or 20 minutes before we open it up for questions talking about more key financial concepts. First, we've talked about assets and liabilities. Assets are things that an organization owns that has either short-term or long-term cash value. Liabilities are things that an organization has to pay. Pay the mortgage, pay the light bill, pay payroll. We haven't talked about accounts receivable or accounts payable yet. Accounts receivable is money that an organization expects to come in. Money coming from a grant. Funding source is an accounts receivable. Money being paid by Medicare or Medicaid or Blue Cross because you provided a service to a Medicare or Medicaid or Blue Cross beneficiary. Those are accounts receivable. Accounts payable is paying the bills of the organization or the program. Again, you have to pay the light bill, the phone bill, pay for supplies, and payroll. Those are all accounts payable. And you probably have individuals in your organization who have those roles. Someone is the accounts receivable coordinator or clerk. Is the accounts payable clerk. You go to that person and say, I don't understand why we haven't paid this bill to this vendor. And the vendors called me and asked me, when can I expect my payment for this or that? That's the accounts payable coordinator. And then there is inventory in an organization. If you are a company that sells something, inventory is a very, very important concept because you have goods sitting on a shelf. It's called your inventory. Let's say you are selling clothing. Any clothing that you haven't sold in your store is your inventory, and it has a value and it has to be handled a particular way by your accountant when it comes to the financial statements. In a hospital, one of the biggest areas of inventory, really two big areas of inventory, is the operating room and the laboratory. Very, very expensive supplies that sit on the shelf, ready and waiting for the delivery of patient care. And perhaps some of you have worked in a hospital and have been involved in inventory counts near the end of the fiscal year. They're always so much fun, but very, very important because there have to be inventory adjustments made from the previous year. So let's say you are a hospital operating room manager. If your inventory count is significantly higher than what it should be, then you need to figure out how that has happened. Or if it's significantly lower, where did all of those supplies go this year? Because they weren't billed to patients. They're not on the shelf in the supply room. They are worth tens of thousands of dollars. So where did they go? And so when finance individuals in an organization talk about inventory, it can be, for some organizations, not a really big deal. But for other healthcare delivery organizations, it can be a big concern, and something that the professionals in that organization need to be very, very much involved with, because it is those health professionals who understand the use of supplies and equipment for the delivery of patient care. I'm sure you've also heard the term audit. As health professionals, we audit a lot of things. We audit patient care services. How were those services delivered? Were they effective? Those are more quality audits. But in the world of finance, audit means a review, either internally or externally, of the organization's financial records. Often, individuals within the organization will carry out a particular kind of audit, perhaps auditing the billing for patient care services, or auditing cash. Where in the organization do employees handle cash? And how is that cash reconciled to make sure that there is proper accounting, and of course that no cash is missing? That is an audit that is handled internally in an organization. But each organization, whether governmental or non-governmental, are required to have external audits as well. It is often conducted by an accounting firm who will come in on an annual basis and essentially review an organization's financial records, how things were reported, and then that report by the external auditors is presented to either the organization's governing board. In the case of a municipality, it may be presented to the city council that an audit was completed and there were no deficiencies found. So important to understand the concept of audit, because there can be audit adjustments that have to be made, and that could ultimately, in some hopefully small way, impact your department or program. And then lastly, with these concepts, the concept of an accrual. In financial accounting, there is an accrual process that refers to the recording of revenues that an organization has earned but not yet received. I mentioned that earlier. If you bill Medicare for a service you provide in one of your clinics and you haven't received that payment yet, it must be handled through an accrual on the books. You're expecting that payment. And the same is true for expenses. If you incurred an expense in a particular month, there has to be an accrual for that expense until that is paid. And so you will hear the word accrual often. Just want to very, very briefly review a few concepts that we will start with when we meet again on October 3rd. And these are budget concepts and terminology. Let's talk about budget versus budgeting. A budget is a plan that is reflected numerically. I used to say it's a plan with numbers on a piece of paper, but today it's a plan on a computer spreadsheet. But it's a plan. Budgeting is a process, and it is so much more than a piece of paper. We will go into the various steps in the budgeting process again in 2 weeks. And there are different kinds of budgets. There is zero-based budgeting, top-down budgeting, and bottom-up budgeting. Zero-based budgeting is the approach that many of you use when you write a grant. You start with a blank piece of paper and you build a budget that will support the program that you are proposing to a funding source. It's zero-based. You start with no assumptions and you build from scratch. But there are also top-down budgets. If you work in a public health department sponsored by the county, then your county leaders or your county commissioners, whatever the terminology might be in your county, may give you a set budget allocation for the year, and that's all there is. That is top-down. And from that allocation, you or the leader of your department has to figure out, with that top-down amount of money, how those dollars are going to be spent. How many staff people, what are the requirements for supplies and equipment and so forth. And then there's what I call the bottom-up approach. And it is really a melded approach of where a department director in a public health organization looks at the programs and services from the previous year, what's gone well, which programs are booming, which programs maybe need some reassessing as to their effectiveness. You look at a lot of statistical information. You work closely with finance representatives, and you don't totally rebuild a budget. You don't start from scratch. You don't zero-base your budget, but you take all that information as sort of a floor, and then you build a proposal for next year's budget. That's more a bottoms-up approach. We've talked about cash. I won't spend any more time on that. And your budget essentially ends up being an operating plan. What are the expected revenues? Even if that is a single source revenue, such as a grant allocation, and what are your expected expenses for the upcoming year? And how do those two things line up? And what is your contingency plan if either of those things change? I mentioned statistics. There is always a statistical budget. It can be very complicated, or it can be as simple as what services are you going to provide in the community? And we'll spend more time in a couple of weeks talking about that. And then lastly is the capital budget. The capital budget is for equipment. Now, as many organizations as are represented today in this webinar, there are equally as, many definitions of what constitutes capital. I have worked in organizations, any equipment over $500 was considered a capital expense. I have worked in organizations where anything over $5,000 was a capital expense. There is no right or wrong answer. Although if you work for an organization that is a Medicare provider, there are some guidelines that your finance folks have to follow when it comes to that capital threshold for buying equipment. There are also some different rules as to what constitutes a piece of equipment. There was an equipment that is expected to last longer than 2 or 3 years. There was a time that a computer was considered a capital item. In many organizations today, it is not considered a capital item because it's not going to last 2 to 3 years. or you will need to upgrade it in less than 2 years because of technology. And those of you in your organizations who worry about budgets, I'm sure, spend a lot of time on capital budget and what the requirements are for your particular organization. So let me just take a moment and summarize. We've gone just about an hour now, and I want to save ample time for questions. Today, we've examined the importance of financial management in an organization, and specifically how important it is for everyone in the organization, not only the finance professionals, to be involved in that process. We've looked very briefly, I would admit, at the funds that are available for the delivery of public health services in our country. And we've begun to examine some financial management and budgeting concepts and terminology. And on October 3rd, we will delve more deeply into budgets, budgeting, types of budgets, and budget processes. I know we've had some questions come in, and I'm eager to get to those, so I'm glad that we have ample time to deal with some of the questions. But before we do that, after we're done with the questions, I want to share with you another passion that I have. I do have a passion for financial management because I believe it is the most important leadership concept and skill. But I also have a passion for history, and particularly history in healthcare. So when we finish up our question and answer session, I want to pose to you a trivia question and let you think about that over the next couple of weeks. And when we come back together on October 3rd, we will discover the answer together. So I encourage you to stay on the line for the questions so you can hear what that trivia question is. So I am going to turn this back to Jennifer, who's going to help me with the questions. As I look at them here briefly, they are in very small print. So for all of us, I think it would be helpful if Jennifer started to read the questions, and I will attempt to answer them. But I also encourage, if there are others in the audience who want to weigh in, this would be a great time. I assume we will be looking to see if you raise your hand in the GoToWebinar system. So don't hesitate to do that if you want to help answer the questions as well. Jennifer.
Yes, well, thank you. That was really great and informative. And our first question is from TT. She asks, thank you for the clear presentation. How does the accounts payable differ from a cash account, like money in the bank, for instance?
Great question. Accounts payable is, and again, I'm going to say this simply, and for our accountant who may be listening, bear with me. An accounts payable is an outstanding bill, is the simplest way to think about it. Your organization purchased something but hasn't paid for it yet. But the finance folks need to account for it. It is an outstanding bill. Let me give you a great example, I think, because when we think of a bill, we think, okay, we purchased something and it was $27.16. What is that in the overall scheme of things? It's not a lot of money. But if you are a healthcare organization that has decided to purchase a piece of equipment through a lease arrangement where you pay a sizable lease for that piece of equipment over a period of 2 years, you pay it on a quarterly basis. Your finance people need to know that that quarterly bill for $17,600 will be coming in every quarter. It is a payable out there in the future that the organization has obligated itself to. And that's different than cash in the bank, if you will. So think of an accounts payable as bills and future bills that have to be paid.
Great. There are no other questions at this time from here.
I think we have a couple of others that have come in. Thanks, Titi. I see your note back. Thank you. Here's a question, and I'm certain for those of you who manage grant funds, the question is, what are the accounting rules for how overhead costs are allocated to different departments? Now, again, if there was a chief financial officer here, he or she would probably give you a pretty different answer. But organizations have accounting guidelines that they follow on how overhead costs will be allocated. Let's say your organization has many different departments, but you have a single phone system. And that phone system is very expensive. It has 57 separate extensions. It has all kinds of calling features. It is a very large accounts payable every month. So who gets to pay that very large phone bill where the phone system is for the entire organization? The accounting guidelines for the organization may say that departments will be allocated the costs based on how many lines, how many extensions, how many phones do you have in your department. That may be one way to handle it. It could be handled evenly. So every department, no matter what, gets their a share of the phone bill. If there are 25 departments in the organization, the phone bill is split 25 ways. There's no real right or wrong answer that I am aware of on the allocation methodology. Now, this becomes a little bit of a sticking point, I know, for departments, organizations, where there are grant funds, and grants will only pay for certain things. But from an accounting point of view, the chief financial officer must allocate equally across the organization, whether it's number of phones or number of departments, but your grant source says, we don't cover that degree of overhead allocation. So this is something that financial experts deal with all the time. They work with their department managers to work out what is equitable, at the same time meeting your grant funds. So that is the whole issue of overhead type allocations to specific departments. And then we can do, I think we have time for one more. We have another one, let's go.
Actually, I just want to encourage all of you to, if you have a question that you'd like to pose, that you can raise your hand and I will unmute you and we can hear some voices on the other line.
Sure, feel free to do that. We'd actually rather hear your voices. Here's, I think, a really great question, and I will share it because I don't know the answer. Why is the terminology different for for-profit and not-for-profit organizations? I probably should have researched that a little bit more. I've asked that question myself. So why does a for-profit organization have a balance sheet and a not-for-profit organization uses different terminology? If there's anyone in the audience who knows that answer, I would be curious as well. It may well be historical because there are different accounting rules for not-for-profit organizations. So I make a commitment that I will try to find the answer to that before our next meeting. Do we have other questions from participants? And again, feel free to raise your hand and we'll open up the mic for you.
Well, thank you so much for joining us this morning.
I appreciate it. I appreciate it, Jennifer. And as I promised, as we are wrapping up, and we are right on time, I'd like to share with you both a personal story and the background for my trivia question. So if you can just hang in there with me 2 or 3 more minutes. Early in the 1990s, when my daughter was about 11 years old, she had to write a paper for school on a famous person. And she decided to write her paper on Jonas Salk, Dr. Jonas Salk, who was the scientist who came up with the Salk polio vaccine in the 1950s. Now, whenever I tell this story, I sometimes see people who don't remember who weren't here in the 1950s and don't know about the 1950s. But you as public health professionals all know about polio vaccines, and Jonas Salk developed the vaccine. So my daughter, I took my daughter to the library so she could do her research. I hate to admit that was before the internet. And we spent several Saturdays in the library, and she was doing a great job on this paper and got near the end of her project and said, "Mom, I don't know, do you think Jonas Salk is alive or dead?" And we could not find information in the library. And so we had read about the fact that there was a Salk Institute in California. I believe it is still there today. And so I made a phone call to the Salk Institute, and a woman answered the phone. I introduced myself and explained that my daughter had done a report, and we could not find out whether Dr. Salk was alive or deceased. And at that point, he was quite elderly. And so she said, "One moment, please." And in about 5 minutes, a gentleman came on the line and said, "I am Dr. Salk, and I am very much alive." And so I have had the pleasure for a minute or 2 of talking with Dr. Jonas Salk. And at that time, the Salk Institute had begun to do research on the HIV/AIDS virus, which at that time was so devastating and so new from a public health and healthcare perspective. Dr. Salk died in 1995, which was just a few years after I had the wonderful opportunity to hear his voice. But as many of you may know, from an historical point of view, polio was a dreaded disease in the late 1940s and 1950s, and children were particularly susceptible. Parents feared allowing their children to go out to play. I remember not being allowed to go swimming because of the fear of polio, and I was very, very young at the time. And so it was in the mid-1950s that Dr. Salk developed his vaccine. But what most people don't understand is even this dreaded disease did not cause Americans to run out and get their children immunized. And there were a couple of barriers. One, people were afraid of the immunization. It was unknown. And to be stuck with a needle 3 times, it was a series of 3 inoculations, was scary when you think about doing that for your children. The second barrier is that the immunizations were about $5 a piece. And so for families, that was quite a cost in the 1950s. So that is the backdrop. And so in the mid-50s, the National Association of Infantile Paralysis, which was the early name for the March of Dimes, launched a campaign to figure out how to get Americans immunized. And so here's the trivia question that we will end with. What is the name of the famous person who most impacted the acceptance of the Salk polio vaccine by the public in the late 1950s? One individual caused the immunization rate to quadruple in less than 1 year. So that's the trivia question, and when we come back on October 3rd, we will explore the answer to that public health question. Jennifer, thank you.
Well, thank you.
It's been a pleasure.
It has been, and before we close, we do have a response to your original question about the different names for budgeting. So
Okay, different oversight agencies have different rules and standards for naming conventions. It does help you know whether you are viewing a governmental versus a for-profit financial statement. Great response. Thanks to the person who gave that to us. I know I've had that experience when I've looked at a financial statement, and based on how it's labeled, I can tell if it is a for-profit, governmental, or non-governmental, not-for-profit. Thank you for that response. We appreciate it.
And thank you to all of you for joining us. We thank you for taking the time out of your work schedule to be with us, and it was definitely an engaging experience. And we look forward to seeing you on October 3rd, when we'll be talking about types of budgets and budget processes. Thank you to Dr. Arsenal. It was a pleasure working with you on this, and we will see you again soon, and have a wonderful day.